Hey guys, Dr. Devon Coughlin here, Revolution Chiropractic. I want to go over a special tip with you today in regards to how medications affect our nutrition. All right, and so a lot of us are really well aware of the idea that certain drugs will deplete our body of certain nutrients. You know, for instance, antibiotics probably being the most common one that everyone knows about. When you take antibiotics, it actually wipes out the beneficial or the good bacteria in your body. So we want to make sure that we're replenishing that with probiotics. So that's the first one I'm going to go over with you, is just antibiotics in general. Every single antibiotic you take, whether it's something you take orally, whether you rub some antibiotic ointment on your skin, what you're doing is you're actually creating a deficit with the good bacteria. So you're wiping out that good beneficial bacteria because antibiotics are not gonna choose between bad and good bacteria. All right. The second one I'm going to go over with you is antacids or any kind of heartburn medication. These are things like Zantac and Prevacid and Prilosec. Things that people take all the time, every single day they're taking. And these things really wipe us out of vitamin B12, folic acid, vitamin D, calcium, iron, and zinc are the big ones. So a combination of B vitamins, your vitamin D, which is so important, some minerals, like I mentioned before, calcium, iron, and zinc. So those are some really common ones that you'll see with antacids. So we really want to minimize those or get off them altogether because they're going to affect our body's ability to absorb some of those nutrients, and they're also going to actually create a deficit in our body of those nutrients. The next one I want to go over with you is actually diabetes medication. And so a lot of people take things like metformin and various different blood sugar sensitivity medications. And so the biggest one with that we're going to see is, again, a vitamin B12 deficiency. It's going to wipe your body out of vitamin B12. It's also going to affect your coenzyme Q10. So that's a big one that we see with statins a lot, and I'll touch on that in just a minute, but we really want to make sure that we're replenishing those nutrients if you are on one of those medications. The other big one is antidepressants. You know, it's one of the most growing medications that people are taking. People are taking them like crazy. Vitamin B2 and then also coenzyme Q10. So again, CoQ10 is a major nutrient for your heart. It's an enzyme that stimulates a lot of reactions. So the antidepressants also lower that coenzyme Q10, like I mentioned before, B2. The last one I want to talk to you in this section is anti-inflammatory. So anything from Advil to aspirin to Aleve, all these anti-inflammatory medications actually are going to deplete us in a lot of ways. Everyone knows that a lot of times they're hard on your stomach, and so the reason why that's an issue is because you absorb a lot of nutrients, or so you break down nutrients in your stomach and you absorb a lot of it in your intestines, okay? So the big things we want to watch out for with anti-inflammatories are things like vitamin C, again, folic acid, which is B9, iron, potassium are all other big ones there. You're also going to see with certain anti-inflammatories, more of the prescription ones, again, the B vitamins, folic acid, B12, you're going to see vitamin C, vitamin D, calcium, magnesium, potassium. So all those electrolytes that people are a lot of times lacking, they're getting muscle cramps and different things like that. Also, selenium and zinc. So selenium and zinc are actually powerful nutrients for your body. Zinc is important for your immune system. Selenium is important for a lot of things as well. Also, when you look at hair, skin, and nails, a lot of times you'll see those come in like a separate vitamin, mostly vitamin Bs. But again, a lot of these medications deplete our body of that. So you'll see if someone's on medication long term, they're not going to have healthy skin, healthy nails, healthy hair because they're lacking a lot of these nutrients. All right, so the next one I want to touch on with you is blood pressure lowering medications. Again, super common. So many people have high blood pressure and they're taking medications for it. Obviously, diet and exercise would be a much better option. But if we need to do these drugs, that's what you want to watch out for. You want to watch out for your vitamin Bs again. So blood pressure is going to affect what we call water-soluble vitamins, your Bs, your Cs, a lot of minerals as well. Things like potassium, calcium, magnesium. Even zinc gets flushed out of your body when you're taking these blood pressure medications. We're also going to see coenzyme Q10, which is a crucial nutrient enzyme for your heart to make sure everything's working properly. That's going to get flushed as well. A lot of people will complain they're tired when they take blood pressure medications. It's because they're losing all these B vitamins, their calcium, magnesium, potassium, and zinc. Those minerals as well, they give us energy. They help with reactions and different things that happen in the body. And when they get flushed out, we get low in them, we get fatigued, and we get tired. So super important watching out for those water-soluble vitamins. We also want to watch out for CoQ10 when we're missing those with those medications. Next one I want to talk to you about is statin drugs. Again, one of the most common drugs in America. Anyone that has cholesterol over 200 is typically being told to take statin drugs, things like Lipitor and Zocor. We want to make sure with these, again, we're looking at that coenzyme Q10. Super important enzyme for the heart, and that always gets depleted with those statin drugs. The other one that in that case is going to be a different group of vitamins called fat-soluble vitamins. So it's vitamin A, D, E, and K. All right, those are the fat-soluble vitamins that you're also going to miss out on, because part of the whole way those statin drugs work is it works on your liver, and it actually stops your body from doing a number of reactions where it creates things into cholesterol. It also affects your vitamin D production, vitamin A, and your body's ability to absorb those nutrients. So you're going to be low in A, D, E, and K, as well as CoQ10 and cholesterol drugs if you're taking those. All right, so the next one I want to go over with you are hormone replacement therapy medications and birth control pills. Again, so many women in their 20s and 30s are still taking birth control pills. A lot of women, even when they're done having kids, will go back on birth control pills. So this is a super, super common one. The main thing we have to watch out for when it comes to birth control pills, again, is your vitamin Bs. Vitamin B2, vitamin B6, B9, which is folic acid, and also vitamin B12. Again, vitamin B12 is super, super important for different energy reactions. Your body's ability to build up red blood cells is important with vitamin B12. We also want to make sure of minerals. Again, things like magnesium, magnesium and zinc are two crucial minerals that we'll see be affected by that. The last vitamin, in addition to the Bs, is also vitamin C. So if you are on these medications, these hormone replacement medications, these birth control pills, you need to make sure you're supplementing vitamin Bs, vitamin C, and then again, magnesium and zinc. Those are going to be crucial for you because your body's not going to absorb them as well, and it's not going to maintain those levels. All right, so really to kind of sum things up, with all these medications, you're going to see the Bs flushed out of your body. That's why so many people take B vitamins. You're going to see vitamin C flushed out of your body. You're going to see some of the fat-soluble vitamins, the D, A, E, and K with the statins. You're also going to see a lot of CoQ10 loss. So a lot of people that as they age, you lose CoQ10 anyway. But if you're taking a lot of these drugs, blood pressure drugs, statin drugs, these diabetes drugs, you're going to be just depleting at a rapid rate. So super, super important. If you have any specific questions on that, make sure you talk to us in the office and we can help put you on the right supplements, good quality ones that your body's going to actually absorb. So again, it's been a tip. Dr. Devon Coughlin here, Revolution Chiropractic. Make sure you're watching our Facebook page and our website for new tips, new posts, new videos. All right. We'll see you in the future for next video.